fluid mechanics. In this I will talk about Bernoulli's principle, what is the importance of laminar flow, what is the importance of the turbulent flow. So let us discuss fluid mechanics. So what is fluid mechanics? Flow is defined as amount of fluid or gas passing in a unit time. So let us say the flow is defined as amount of fluid or gas passing in unit time. Okay, so flow is amount of fluid or gas passing in a unit time. And flow becomes turbulent from laminar, right? Flow becomes turbulent from laminar flow when the Reynolds number is above 300. So we need to understand what is turbulent flow, what is laminar flow, what are their clinical implication, and what is the Reynolds number, and what are the factors which control this Reynolds number, and why we don't want the flow to become turbulent from laminar, why we prefer the laminar flow. So what is laminar flow? The laminar flow is smooth, even, non-tumbling flow. As you can see, smooth, even, non-tumbling flow which flow in a conical pattern. What do I mean by this? Conical pattern, that is the middle part of the flow of the liquid or the gas reaches the destination before the side part of the gas is reaching. So it's called conical flow. So this is smooth, even, and non-tumbling, right? And we call it produces a cone effect. So even when the flow is laminar, even before the total flow reaches the alveoli, the mid part of the gas has reached to the alveoli. So this is always, laminar flow is always what is preferred. So what is turbulent flow? It is rough, tumbling, and uneven flow pattern. We call it square pattern, rough, tumbling, uneven. This is turbulent flow. And when the flow is laminar, then the different factors governing the flow of the gas is different from when it is turbulent. So when the flow is laminar, which law governs the flow of gas? It's the Huygens-Pauchel's law. Now this is applied for laminar flow, and it states that flow through the tube is directly proportional to the pressure gradient across it, and it is fourth power of radius, and inversely proportional to length of the tube and the viscosity of the gas. So the flow is directly proportional to the pressure difference. So if this is a tube and the gas is flowing through it, okay, so what would be the difference of the pressure between at the two ends of the tube? The flow is directly proportional to it. Then the flow is directly proportional to the radius power of 4. More the radius, better would be the flow. It is inversely proportional to the length, and it is inversely proportional to the viscosity. Okay, so if the gas is more viscous, the flow would be less. If the length of the tube is more, the flow would be less. Okay, so this Huygens-Pauchel's law says pi to the power into r to the power of 4 multiplied by the pressure difference divided by 8 the viscosity into the length, right? So flow depends upon the radius, it depends upon the pressure difference, it depends upon inversely on viscosity and on length of the tube. Okay, now these things which I just discussed, this can be easily calculated, right? It is directly varying with these variants. What about the turbulent flow? Now turbulent flow is not governed by Huygens-Pauchel's law. It is governed by Graham's law. So what does Graham's law say? It states that flow rate is directly proportional to the square root of pressure gradient. Now it is not directly proportional to the difference in the pressure. It is proportional to the square root of the pressure gradient on the either side of the tube, and is inversely proportional to the square root of the density. So now when the flow becomes turbulent, it depends upon the density, square root of the density, and the square root of the pressure difference. Okay. So when will the flow become turbulent? When will the flow become turbulent? And instead of Huygens-Pauchel's law, we have to apply Graham's law for calculation. What factors dependent upon the flow? Reynolds number. Now, what is this Reynolds number? It is a dimensionless unit. It's a dimensionless number. It's a dimensionless number which is calculated by multiplying the velocity of the gas multiplied by density multiplied by the diameter of the tube through which it is passing and divided by the viscosity. So it is velocity multiplied by density multiplied by the diameter of the vessel through the tube through which it is passing divided by the viscosity. This is what is calculating Reynolds number. Now guys, if the velocity of the flow of the gas is higher, if we are giving very high flow, the Reynolds number will increase. Okay. Higher the Reynolds number, right, the flow would turn from laminar to turbulent. So if the Reynolds number is less than 200, the flow is always laminar. If it is between 2000 to 3000, the flow is it could be laminar or turbulent, right? And if it is more than 3000, then the flow becomes turbulent, right? And we don't like the turbulent flow. We want the flow to be laminar. So to maintain the flow to be laminar, we need to keep the Reynolds number lower side. So velocity we have to keep less. The gas which are less dense, they would have a lower Reynolds number. So less dense gas would flow in more laminar pattern. If the velocity is less, the flow would be in the laminar pattern. If the diameter is more, the flow would be more in the laminar pattern. So we will apply all these things in our discussion, the clinical implication, right? So first let us discuss the difference between laminar and turbulent flow. We have already discussed. We will again just tabulate it. So as I said, flow in steady state is laminar flow. So steady flow, steady manner of flow is laminar flow. What do I mean by laminar flow? The flow is highest or greatest at the center. So flow is greatest at center. This is the laminar flow, greatest at center. Okay. Turbulent flow in a square pattern or turbulent matter. So non-steady flow or haphazard flow. Non-steady flow in square pattern. That is like this. Okay. So what is the determinant of laminar flow? We have already discussed the laminar flow is governed by Huygens-Pauchel's law. So the determinant is your pressure difference, diameter of the tube, the length of the tube, and the viscosity, right? So it is governed by Huygens-Pauchel's law. And when the flow is laminar, the less resistance, flow faces less resistance. So it will have low resistance. Okay. It will have low resistance. Okay. Now, when the flow is turbulent, it is not guided by Huygens-Pauchel's law, and it is not determined by directly in the difference in the pressure difference. It is determined by the square root of the pressure difference, and it is determined by the square root inversely proportional to the square root of density. Okay, so it depends upon the density. When the flow is laminar, it depends upon the viscosity of the gas, which determines, and turbulent, the density of the gas determines, right? And when the flow is flowing in the turbulent manner, the high resistance, it faces high resistance. Okay, so we want the flow to be in laminar pattern. So what would be the clinical implication? If we keep the diameter more, right, the flow will more be in the laminar pattern, right? The Reynolds number will be less because from laminar to turbulent, it depends upon what? Reynolds number. And Reynolds number is the multiplication, I mean it is a dimensionless number. It is multiplication, it is product of your the diameter or the radius of the tube multiplied by the density, as we have calculated, multiplied by the density, and your let's say the viscosity, inversely proportional to the viscosity, right? So it is directly proportional to the velocity of the flow, density, and the diameter. So it is, the Reynolds number is directly proportional to the diameter, right, viscosity, and the and it is density, and it is inversely proportional to the viscosity. So what is the clinical implication? What would be the clinical implication? Now, what is the importance of selecting right size of ET tube, and why we should not use connectors with sharp curves? Because at sharp curves, the flow would change from laminar into the turbulent. So what happens? Now each piece of anesthesia equipment, each piece of anesthesia equipment has pressure or is affecting flow. Each piece is affecting flow by its shape, right, of the anesthesia equipment. At sharp bends, the flow becomes turbulent, right? So we have already discussed, if the flow is turbulent, the resistance will increase. This increases resistance to flow. So to decrease this increase in resistance, we need to use wide bore and curved connector, right? So we should use wide bore and curved connector. Okay. Next is, what is the importance of selecting right size of endotracheal tube? If we will use a very small diameter of endotracheal tube, the resistance would be very higher because the flow would become from laminar into turbulent. We have already discussed the flow depends on the radius, right? It depends upon the radius. The flow is directly proportional to the radius power of 4 when the flow is turbulent. Okay, when the flow is laminar, right? It is directly proportional to the radius power of 4. So if what happens is the resistance would increase. If the resistance increases, the flow would decrease. So if radius or the diameter of the tube is decreased, the resistance increase in a huge amount, in the 4-fold amount. So if the radius is less, the resistance would be very, very high. It will increase by 4-fold. And if the resistance increases, the work of breathing increases. So resistance increases, work of breathing increases. Work of breathing would increase, right? So if you see, this is the cross section of trachea, and this is the cross section of trachea with a tube. So what is happening? When the flow of gas is through the trachea, it is passing through a larger diameter or larger radius, and when it is through ET tube, it is passing through a lesser diameter. So definitely the resistance will always increase when the patient is breathing through endotracheal tube. If patient is breathing through normal airway, the resistance is less than 2 centimeter of water, right, per liter per second of flow. And if we put a right size ET tube, then it would be like 5 centimeter of water per liter per second. And if we use improper size, this resistance would further increase, right? And when the resistance will increase, the work of breathing will also increase. Work of breathing will also increase. So we need to use the right size endotracheal tube when we are putting it in the patient. A smaller size endotracheal tube will increase the resistance, increase the work of breathing. Okay. Okay. Right. Next is in asthmatic patient. Now airway. This is the airway. Right. And let's say when the patient has hyperreactive airway, the diameter of the airway decreases. Again, as the diameter is decreasing, the resistance will increase. So if I want to give patient oxygen through a narrow diameter tube to keep the Raynaud number under control, right, we need to use a lesser dense gas. We need to give the lesser density of the gas. So instead of oxygen, nitrous oxide and air, or air with oxygen, if we mix oxygen with helium, right, oxygen with helium, okay. So remember, when the gas, the mixture will flow through a narrow tube, the narrow tube will make the flow turbulent, right? And when the flow is turbulent, the flow is inversely proportional to the density. So if I give a gas which is less dense, right, then the flow will increase. So in asthmatic patient or in COPD patient, when the airway has become narrow and the flow is becoming turbulent, if we decrease the density of the gaseous mixture, then it will be better delivered. So that is what oxygen plus helium mixture does. Helium added to oxygen decreases the density and decreases the turbulence of the gas, and it will increase the flow of gas, right, So heliox or helium, we call it heliox or helium. This is used as the oxygen delivering gas, right. Helium mixed decreases the density and facilitates the flow of gas through a narrow airway channel. So this is the importance of heliox. Okay. Now, what is the importance of viscosity and density regarding the accuracy of flow in flow meters at different atmospheric pressure, Now guys, flow meter, that is not a uniform, it doesn't have a uniform diameter. It has a lesser diameter at the lesser, it is like kind of Y-shaped. It has lesser diameter low and at the lower part and more diameter at the higher part, right? So flow of gas is more, let's say, laminar on its lower part and more turbulent on its higher part. So, right, as the flow becomes higher, we have discussed the flow changes from laminar to turbulent. So, in flow meters, right, Higgins-Porcelli law, flow meters, at low flows, when we keep the flow low, at low flows, right, Higgins-Porcelli's law applies, right, and flow is laminar at less flow, right, and flow depends upon viscosity, right, depends on viscosity. At higher flow, the flow becomes turbulent, and now it depends upon density. The flow depends upon density, not on the viscosity. Okay, so at higher atmospheric pressure, we all have discussed. Now, density is equal to mass by velocity. Okay. Now, each gas has different viscosity and different density. The gases have different density, right, and different viscosity. Your flow meter is calibrated at standard temperature and pressure. Okay. So when we move the flow meter at let's say at a higher altitude, that is that higher altitude, the density decreases, the gas becomes less dense. So density decreases. So as at higher pressure, atmospheric pressure, density decreases. Flow which is inversely proportional to the density, right? The higher flow which we are giving depends upon the density. So as the gas becomes less dense, the flow will increase. So whatever setting we have done in the flow meter, say I have done to flow the gas at 2 liter per minute, it will flow at a higher flow. So flow will be higher at a higher atmospheric pressure than the set flow. So flow will be higher than set flow at lower atmospheric pressure. Sorry, at higher altitude, not lower atmospheric pressure, at higher altitude, because at higher altitude the density of gas decreases and flow is dependent inversely on the density. So at high flow, when the flow is dependent on the density of the gas, as the density of the gas is less, whatever flow we have kept gas will flow at a higher rate. It will flow at a higher than the set rate. Okay, so we have to be careful. Now what is critical flow? Critical flow is the let's say laminar is flow at the point when the laminar flow gets converted into the turbulent flow. So critical flow is flow at which laminar flow becomes turbulent flow, and the numerical value is same as the diameter of the equipment at which the flow becomes from laminar into the turbulent. So if I am using 8 mm internal diameter ET tube at 8 liter per minute of flow, the laminar flow will become turbulent. So when I am giving the flow from 8 mm internal diameter tube at 8 liter per minute, the flow will become from laminar to turbulent. Okay. So we have to remember this is what is critical flow. So whatever equipment you are using, you should keep the flow less than the diameter of that equipment to maintain the flow, laminar flow. Laminar flow will produce less resistance. Okay. Now let us talk about cannula. Cannula which we use for fluid resuscitation. We have different sizes of cannula with different diameters. The cannulas with the more diameter, let's say your 14 gauge or your 16 gauge cannula, the wide bore cannula. These are the wide bore cannula. These cannulas, they have short length also, right? So flow is directly proportional to the radius and inversely proportional to the length. So if it has more diameter and less length, it will produce a higher flow of liquid. So that's why when we are doing a fluid resuscitation, better than putting a central line, a wide bore cannula would be more helpful. So during fluid resuscitation, wide bore short cannula would be best. So if I have to put cannula for giving fluids, rather than putting central line, I would put a 14 gauge cannula because it has a shorter length and wide bore. Okay. Now let us talk about very important principle which governs the fluid mechanics, Bernoulli's principle. What is this Bernoulli's principle? So what does this Bernoulli's principle says? What is the Bernoulli's law? Now Bernoulli's law is applied to your fluid flowing in the vessel. So when a gas or a fluid flowing through a tube encounters a constriction, at that point the pressure drops. Here the pressure will drop because velocity of the flow will increase, the kinetic energy will increase and the potential energy will decrease. So pressure will drop, right? And because the velocity increases, that is the kinetic energy increases, the potential energy decreases. This is called Bernoulli's principle. This is based on law of conservation of energy, right? So at constriction, the flow becomes higher, the pressure drops. So here the pressure will drop, right? And this is applied both to liquid and gas. Liquid and gas. So remember, when liquid flows through a tube of varying diameter, pressure is lowest at the point of maximum velocity. So when fluid flows through varying diameter, pressure is lowest at point of maximal velocity, right? And this is applied to liquid and gas both. Now, Venturi principle is based on Bernoulli's theorem. So this Bernoulli's principle governs the Venturi effect. This is based on the Venturi effect is based on the Bernoulli's principle. Venturi tube is created based on Bernoulli's principle. So what is a Venturi tube? It is a tube with a cross section which gradually decreases and then increases. It is a tube with ununiform diameter. It has a cross section which would decrease and then it would gradually increase. So this is Venturi tube. So Venturi principle is used in this, which allows the second gas or a fluid to get entrained when the pressure drops at constriction. So let's say when there is a constriction, here the pressure will drop. So whenever the pressure drops, the gas or the liquid moves towards that low pressure. So when we construct this kind of tube, there would be entrainment of the fluid or the gas into the constricted portion of the tube. So entrainment of air from the surrounding due to fall in pressure at the point of constriction. This is what is called Venturi's effect, right? And this applies both to liquid and gases. Now we have utilized this Venturi's effect, right, in number of devices which we use in our oxygen delivery. One very important is your Venturi mask. So what is this Venturi mask? Now Venturi mask is an apparatus, or we call it Venturi barrel, which doesn't have a uniform diameter. As you can see in the image, it has a constricted lesser diameter tube, and then the diameter of the tube, the cross section of the tube increases. Because of this change in the cross section, right, at the constricted part, what happens? The pressure drops. There are holes created in the side wall of that constricted part. When the pressure drops, the room air is entrained into this Venturi barrel. So overall flow received to the patient will become higher. So I am trying to tell you that the Venturi mask, it has Venturi barrel, which are tubes with different cross-sectional area. Now this is a lesser cross-sectional area, this is a higher cross-sectional area. As you can see, lesser cross-sectional area, higher cross-sectional area. So when we give gas at a flow, right, when it goes into the constricted part, here the pressure decreases. What has been done? Here the opening has been created in the side wall, and by this, because of the drop in the pressure, the entrainment of the gas will happen. And ultimately, patient will receive a higher flow of gas than what we are giving through this Venturi mask. If I am giving oxygen at 15 liter per minute, more and more room air will be entrained and patient will receive, let's say, 30 liter of total gas. Now that depends upon the flow, how much the entrained gas, it depends upon the flow of gas, and it depends upon the constriction, how much the opening which we have created. So this is how the Venturi mask becomes a high flow device, still being a mask. It's a mask. We are giving gas, it's not a blending system. So we are giving oxygen at a particular flow, but because of the entrainment effect, it entrains room air and patient receives more total flow more than what we are giving, right? So this is because of Venturi effect. So what is the entrainment ratio and how it is calculated? Entrainment ratio is defined as ratio of entrained flow, how much the gas is entrained, to the driving flow. And total entrained flow is due to Bernoulli's effect and the jet entrainment. So entrainment ratio is entrainment flow by driving flow, as I said, right? So if it is 9:1, the entrainment ratio,